Hi, everybody. Welcome to our first quarterly community meeting of 2024. I'm Mandy Ashley. I'm the director of the Aurora Health Alliance, joined by Joe, who's our program manager. We will get things started, but first, thank you to our affiliates who are listed on this slide. We couldn't do our work without you. Of course, if you're interested in becoming affiliate, let me know.
All right, so we have a full Did You Know panel today. We are happy to have you all. We've got Michele with Arapahoe County Public Health, Jeannie with Children's Hospital, and Lauren with Veterans Health Administration. And I know we want to be mindful of time for folks, so we're going to go ahead and give it to you, Michele. Thank you so much.
Hello, everyone. I'm Michele Ebendick. I'm with Arapahoe County Public Health. I think Joe's going to bring up the slides. Oh, perfect. I'm in our maternal child health program, and so here to talk a little bit about what maternal child health is and what we do at Arapahoe County. Go to the next slide, Joe. So we call ourselves a maternal child health program, and everyone refers to us as MCH, but what it actually is, it's a funding source. It's a federal funding source, Title V block grant, and it actually is part of secured funding since 1935 as part of the Social Security Act. So this is funding that's been around for quite some time, and the whole goal is to improve public health systems for mothers, children, and families, including those children with and youth with special health care needs, which we refer to as SHIN. And every state applies for these fundings from the feds every year, and then they trickle down to locals, and it's all based on need and population in the funding formula. Next slide. So our maternal child health program at Arapahoe County Public Health has 4 different priority areas that we work within. There's I think 7 at the State Health Department, Colorado Department of Public Health and Environment. The maternal child health program there has a menu of priority areas that local public health agencies can select based on needs in the community. And they all wrap up and relate to performance measures that that we're trying to achieve to improve the well-being of children, mothers, families, and children with special health care needs. So at Arapahoe County Public Health, our 4 priority areas that we're working on right now with this stream of funding is reducing racial inequities, increasing access to supports, and specifically within the increasing access to supports is where we're doing a lot of our work to support children and youth with special health care needs. We also are looking at social emotional well-being, overall general behavioral health, but also some of our child fatality prevention systems review work is embedded in that, and then economic mobility. So really that financial well-being, looking at financial health is a pillar of overall health for families. So these are kind of our pillars in which we work. And as a result of that, if you want to go to the next slide, I wanted to share some of the different projects that we participate in at Arapahoe County Public Health. So the first one is the Get Ahead Colorado campaign. This is the tax filing campaign. It's been around for some time and now currently lives at CDPHE, but it is to promote earned income tax credits and other tax credits that help families, quote, get ahead. And so we do outreach, we share resources, present at different meetings, and really try to push out that campaign to encourage those that are eligible for no-cost tax filing to utilize those services, as well as ensure that they're getting all of their tax credits they earned. And in Colorado, to file taxes, you don't need any official training. So any of us could open up a tax filing service on the corner and start filing taxes and charge for it. But going through the Get Ahead is all IRS certified tax filers. So it's definitely a great resource and something that we've partnered with in the past, and we'll continue to push out, and happy to share those materials, or you can join the kickoff meeting February 1st, when they will kick off, the state will kick off the Get Ahead Colorado campaign with all of the materials. We also partner with community-based organizations. So these pictures here that I'm sharing, one is a childcare bus with Illuminate Colorado. So looking at how could we utilize the childcare bus that's meant to support families and children who are going through substance use disorder treatment. So it's on-site mobile childcare unit for those individuals in outpatient services. And so we are working with Illuminate Colorado to find a home so that we can have the mobile childcare unit in Arapahoe County a couple hours a week. So that's one of our pieces, is how do we partner with community organizations to meet the needs of our community. Another huge one that is fairly new is working with El Grupo Vida and seeing a need for newcomers to have a place to access no cost basic need, clothes, bags, blankets, shoes, toys for toddlers and children. And so they actually, within the past couple of months, as a result of working with them, created the Exchange Boutique. And so any newcomers can come into El Grupo Vida, take what they need, drop off what they don't need, and have a place to gather what they need to stay warm and clothed during their process of finding their home here. So that's another example. Some other work that we're doing is working on language justice, not only within our health department, but how can we ensure language justice across our community, that we are meeting the needs of our unique and diverse community as it relates to language. We're doing some work with Aurora regarding firearm safety and distributing fire or gun locks, as well as looking at other opportunities to focus on firearm safety. Medication safe storage. We've been working with some nurse home visitors by providing them with materials to give to families so that medications are safe and out of our kiddos' hands. Our maternal child health team facilitates the child fatality review. So any child death that has happened in Arapahoe County goes through a review process with community partners. And at the end of that, we look at what are prevention opportunities, and of those prevention opportunities, what could we actually implement, do, change within the community at a systems level. We also do resource and support navigation. We do not provide it to the general public, but more for our community providers who reach out and say, hey, how do I navigate X, Y, and Z? And we also support our nurse home visitation programs and WIC within the health department, and helping them support families through navigation. But again, we do not do general navigation and resource support to the community. We do training for staff and community. We did a liberatory design process where some of you here were part of that. It's a training that really looks at breaking down systems, removing those systems, and looking at what does the community need, what do they want, and how do we allow them to design. And the Exchange Boutique, these pictures up above, is that's actually where that project came out of, was the liberatory design training that we went through. We are currently going through a frameworks training with the Financial Health Institute, as well as with 32 other staff at Arapahoe Public Health, to really look at, again, how is financial health a pillar of health, a piece of our overall health. So bringing some trainings to our community and to our own teams internally. We do developmental screening and connection to services, so train community partners, as well as internal programs on developmental screening and how to connect to programs like developmental pathways, child find, etc. And then we do advocacy for our work, and we provide content expertise at various meetings that we attend to really focus on equity, our 4 priority areas, but really the maternal child health population in general, specifically children and youth with special health care needs. So that's a little bit of our project and our partners. That was a lot, I know. Any questions or wonderings?
I have a question.
Okay.
How does MCH define, or how do you define language justice? It's floating around I'm sorry, my dog is barking.
That's fine. So it's
He has
definitely a
thoughts
continuum.
he has thoughts on it. But maybe if you have just a loose definition. I know there are people working in this space, but everyone seems to have a little bit different definition. Thanks.
Yeah, I don't think that we have specifically a definition at Arapahoe County Public Health. It's definitely evolving. And I think it's this, I would say right now we are in the equity phase of language and ensuring that we have materials and services available to our community in various languages. However, we definitely want to get to this shift of what is language justice in terms of what are our beliefs, what are our core values, how do we stand behind supporting our community, and that it's the first thing we think about and not the second, third, fourth, or last thing we think about when we are interacting with the community. So I would say it's an evolution that we're going through as public health, and only a year and 17 days into this. But something that we would love to learn from others, participate with others, and really, how do we have that mind shift switch to this language justice piece instead of interpretation, translation being the thing? There's so much more that we can do, and it needs to be, I believe it needs to be more of a philosophy and our core value of meeting our community where they are with the language of their heart. So no definition, sorry.
No, that was perfect. I had a question come in to me separately. Just wondering what the team is most excited about in 2024. I love that for a New Year's question.
Oh, that's beautiful. Joe, you should just add that to your questions when you send out to the panel of did you know? What are you most excited about? I think what's most exciting within maternal child health is that it's pretty secured funding, and we get to continue to evolve this work, but also be responsive to the community. And so just this morning, we had a conversation with a community partner, and we're tossing around ideas, and we absolutely are in a place now that we're a year as a health department where we can jump in and participate. And so I think being in this place of responsive to the community, supportive of the community, what do they need? The maternal child health program will be part of the kids convening and supporting that work. So really excited to just be part of the community and a resource when you all need us for advocacy, content expertise to learn with you, etc. What is the referral process to MCH programs? So we do not have a referral process because we don't provide direct services. Our work is all at the systems level. So no referrals to us, but we can connect you to specific programs if you need connections. But we do not do any direct services. We're all at the systems level, working with our community partners, working with our internal programs at public health. Anything else?
Any other questions? Is there one more slide?
Just one that says questions with my contact
okay.
information.
Okay, great.
So feel free to email me. I can also throw it in the chat. If you have any questions or opportunities to think about how we could connect or support one another, we would love to participate. There's more than just I on the team. I have 4 other colleagues with various FTE within the program. So we are happy to partner, support whatever we can do to be part of the community.
Great. Thank you so
you.
much. Thank you. And folks, if you do think of other questions, feel free to put them in the chat because we will capture them. And we're going to move on to our next speaker, Jeannie Dixon.
Oh, good afternoon, everybody. Thanks for having Children's Hospital in your respected living rooms, office spaces, couches, and coffee shops. It's good to be here, and we're excited to present to you today a little bit of history and current programming for the Black Health Initiative. I want to be clear that as we move forward, that the Black Health Initiative right now is focusing on maternal and infant mortality, and the mitigation thereof. So the context in which I bring you this information is strictly about that. So let's get started. Our whole vision for the Black Health Initiative and Children's Hospital of Colorado is the disruption of structural racism within the healthcare environment. So I want to keep that in mind. And that's slide 2. It's just a brief position statement about our vision. So if you want to just take a look at that quickly, that'll let you know what's going on. Our plan is to have this vision realized via improved patient and family experience scoring. And we're working on that. That's a work in progress, and we'll continue with that throughout the scope of the work, which is expected to have some pretty good numbers by 2025 from feedback from our patients and families. We originally started this work in some focus zip codes of Aurora, 845, 812, 814, and 815. The need was so great, we've had to expand it. So our work now is being conducted in the greater metro area. So we're excited that people want our information, want to be disruptive about how we change equity, health equity, especially among African-American women and their babies, and keeping them alive. A little bit of backstory. I'm going to start with things that you may or may not know. During 2023, Kindred Mama's Mentorship Program supported 7 African-American mothers by providing 394 hours of one-to-one contact, 8 hours of individualized group training, and 12 hours of mentor development training. Let's talk a little bit about Kindred Mama's Mentorship Program and what it does. We realized through focus groups, which we call dinner talks, also known as town halls, in 2019, 2020, and 21, during the height of the pandemic, we held focus groups to talk about what the greatest need was. We knew late in 2016 that there was a culprit among us, and that was accidental deaths, premature deaths, specifically among women in the state, African-American women in the state of Colorado. And we wanted to go into the communities and find out what the heck was going on. Well, to our surprise, many women didn't even know that there were these deaths, the accidental or premature, among this specific population. So we asked them, well, what can we do to bring awareness? And then once awareness is gained, what can we do to support the situation? And out of these discussions, some 6 or 7 discussions, probably meeting with some 67 women in the community in those targeted zip codes areas. They told us that 3 things were important: access to health care, mental health, behavioral health for their children, and education, simultaneous education between the mothers, community members, and providers. As a result, that's why those numbers stand right now, because the programming is one-to-one programming from a current Children's Hospital team member who is African-American and an African-American mom within the community. They apply for the program via referral through their provider and or a social worker or someone in the community. They, at this time, have to be a patient or family of Children's Hospital. We let them guide their relationship. And their relationship comes via a match with the team from Children's Hospital, which might include a social worker, that lets them know that they have somebody who can walk alongside them, who can help them navigate the system. And as a result, we have placed women in these relationships, and some who have even had children during this time, and those who have taken advanced training for community advocates, leading into our signature program, which is the program for simulation education, which places them in one-to-one relationships alongside a medical provider. That's our Kindred Mama's Mentorship Program. Next, certainly not least, is what some of you may have heard in the community called the Black Health Initiative Community and Provider Partnership Simulation Training. It's known as BHI CAPE. And I know you don't like to hear acronyms, but that simply stands for the Black Health Initiative partnership with the Center for Advancing Professional Excellence. And within this particular program, what we do is we train individuals, specifically new residents and providers, along with community advocates, in the development of adaptive communication skills around DHE&I and implicit bias. So it is, in fact, a DHE&I program. These trainings operate under this premise that there is a community advocate along with a provider in a room with the standardized patient, having been briefed about an authentic, real scenario involving a health inequity and a patient and family. It is up to the community advocate and the provider to determine where the mistreatment occurred and how to best communicate that they are now in a safe space, a brave space that will allow them to work through and achieve health equity in an emergent care or a medical clinical environment. So I'm going to ask you a question. Did you know that during 2021 through 2023, the Black Health Initiative Community and Provider Partnership Simulation Training has provided over 736 hours of DHE&I, adaptive communication skills, and implicit bias instruction to over 92 providers in partnership with the University of Colorado School of Medicine, their Center for Advancing Professional Education. Did you know that? You can use your emoji, your reaction button, and be honest, yes or no. If you did, great. That means that you're probably one of those providers and or community advocates that have been trained. If not, if you have a thumbs down and I can't see you, so no judgment, you probably need to take the course. And I will send along a flyer with information that tells you how to sign up and learn more about yourself, more about how we are better culturally responsive to patients and families, especially our Black mothers who experience inequities, and how to face your fears. And then I want to talk to you a little bit about, remember, I can't see your thumbs up. So if you've got questions along the way, just hang tight. I'll get with you. And then what I'd like to talk to you about, a program, is our African American Family Advisory Council. It's a parent advisory council that is supportive of over some 15 departments within Children's Hospital Colorado, supporting them in their work to be more inclusive and to be better stewards in the care in which they give. So the African American Advisory Council, as I said before, as I mentioned, partners with more than 15 internal organizational departments. And what we do is we help assess and elevate the inclusion of BIPOC LGBTQ individuals in providing culturally responsive care to patients and family. Our external outreach with the African American Family Advisory Council includes support of outdoor festivals and family activities, in particular Juneteenth, and Families Against Domestic Violence. These are all neighborhood festivals. And more often than not, we are in contact with over 100 individuals per event. Right now, the African American Family Advisory Council has two working programs. One is which is asthma and understanding, and then after understanding, teaching families that their child can be active with asthma, and then working hand in hand with safety and injury prevention programs to make sure that our children are safe regarding seat belts and passenger safety within cars, and also with safety, sleep safety. So we're pretty busy in fulfilling our promise to disrupt. These are all things that for a long time, Children's Hospital, because of relationships within the community, weren't getting the word out that we were interested and that we wanted the community's input. And now that we have it, we are allowing the community to guide the work. So in every step of the way, with each of these significant programs, the Kindred Mamas Mentorship Program, the BHI CAPE, the Black Health Initiative Community and Partnership Simulation Training, and the Family Advisory Council, which in and of itself is 80% parent seated, is now getting the word out about these things that are important. They're guiding the work, they're leading the work. We just give them the tools and the resources that they need to better provide support services within the organization, within this population, keeping mamas and babies safe through the first 2 years of their life. I think I went really quick through that. And if somebody can tell me if we have times for questions, I can probably elaborate a little bit more about each of these programs. And again, I can't see you for some reason.
You absolutely have time for questions, and apologies that there is the last slide you have with the information about each program. So apologies about that. I'm putting that on the slide, showing that slide now, but
Yeah, I have a question just from myself. How is the Black Health Initiative partnering with other community groups who are focused in on the same issues, such as Families Forward Resource Center, other groups?
Absolutely. So we do have a formal agreement with Families Forward Resource Center, and have a strong partnership with them and helping them meet their needs through a HRSA grant, and providing opportunities for some of their families to join us in our programming around care collaboration, and specifically around community advocacy within the Black Health Initiative CAPE program. We've also been in talks with the Center for African American Health,
Nice.
and hopefully we'll put together some kind of agreement so that we can support one another along the area or along the lines of behavioral health, because we know that that is critical in keeping these moms and babies together. We're also working with the Black Mama Circle, which is born out of the Pediatric Mental Health Institute, to address the behavioral needs as well. And it is our hope that late this month or sometime the first quarter of 2024, that we will be able to train individuals who have gone through our care collaboration program in conjunction with FFRC along the lines of peer support behavioral health specialists.
While other people are continuing to brainstorm questions, another one that came to me was how a mama who has not had kids yet isn't connected. How is this programming reaching somebody who is having their first kiddo? Is it through the simulation programs or the separate trainings that are happening? And then are those trainings happening like on campus where women are giving birth, or people are having children across campus?
So they're two separate programs. The Kindred Mama program, these women come to us by referrals, again, from internally through Children's Hospital and through the University of Colorado, the Women's and Infant Center there. And that's how we are connected. They are then matched through the provider or a social worker, or in one case, through the court system. We had a detective once call us and tell us that one of our moms who was a mentor within Kindred Mamas had referred her to one of their probationees. So we get them from those. Our main sources are from there. Usually it's word of mouth. It really is. It's word of mouth. The Kindred Mamas program is separate and apart from the BHI CAPE simulation program, in that the BHI CAPE simulation program trains specifically providers and community advocates around implicit bias and health inequities and adaptive communication. So they are two separate programs. However, what we anticipate happening very soon is that the mentees from the Kindred Mamas program will go on to become community advocates, supporting the work of the CAPE.
Awesome. Thanks for the clarification.
Yes.
Thanks, Mandy. Any other questions? And again, if you think of them as we go along and things process in your mind, feel free to put them in the chat as well. We can always capture them and send them to our presenters. Jeannie, thank you so much. Do you mind if we share your slides after we do a post quarterly meeting send out, and would love to share your slides with folks?
Yes. And what I'd like to be able to do is to send along information on, and perhaps I can just put it in the chat, ways for which you can ways in which you can contact us, specifically for Kindred Mamas, which is Kindred Mamas at Children's Hospital Colorado, to let us know if you're interested, or to see if you know of a mama who needs help navigating the healthcare system, where we can be supportive and provide a one-to-one match with another woman who's walked a similar path and can help them navigate the system and get the training that they need to continue to be good moms. Also, if you are interested in BHI CAPE, the simulation education program, where we're pairing women in the African-American women, by and large, in the community to serve as community advocates alongside providers, so that they learn how to be more culturally sensitive in a clinical setting and in an emergent room. You can use BHI at Children's Hospital Colorado to contact us, and we'll send out information so that you can join one of our learning labs.
Awesome. Thank you so much. And yes, if you put that information in the chat, we'll capture it, and we'll put all this great info together and send it out to folks as well, so everyone has it.
Last question. What, and Lauren, this is a preview for you. What are you most excited about in 2024?
Oh, the opportunity for growth. The opportunities for growth. It is our goal, certainly not by 2025, so don't hold us to that yet, to have every new resident and every current faculty provider associated with Children's Hospital Colorado trained in culturally responsive care and implicit bias and adaptive communication skills. That's our goal. And then I'm excited because it looks like we're going to be engaging more women in the Kindred Mamas mentorship program. So we'll be able to help more moms be successful in being good moms, and providing resources through our Resource Connect Center, along with other tools and resources that we have at Children's. We'll be able to help these moms be real successful. So we're excited about growing that from 7 to 8 to possibly maybe 15 within the next year.
That is definitely something to be excited about. Thank you. Thank you for sharing.
All right. Thank you all for having us and becoming more aware of what Children's Hospital Colorado has to offer regarding maternal and infant mortality and the work that we're doing, saving moms and babies.
Thank you. Thank you for the work you're doing. Thanks for being here.
Yes, thank you.
Awesome. All right. Lauren is with Veterans Health Administration, and Lauren will be speaking to us next about the great work you're doing. Thanks, Lauren.
Hi, everyone. Thank you for having me. Those are some tough acts to follow, but I will do my best. I don't have any slides today. I just thought I'd speak with you about what I do and some data about homeless veterans in our community, how to get them connected to VA housing programs, and all the things. There's just so much to cover. So my role within the VA, the coordinated entry specialist. So essentially I am a gap filler, which in a federal health institution, you can imagine there's a lot of gaps. So my role is to collect data about the veterans that are experiencing homelessness within the 7 metro county region, Denver Metro. Also to educate and train homeless community providers about how to get veterans engaged with the VA, registered, how to check eligibility, and how to get them warmly handed off to these housing programs, whether it's within the VA or outside community members. Because not all veterans actually want to work with VA for valid reasons. Maybe they've had some negative experiences in the past, or that's just, you know, their choice to work with us or to work with a community provider. But either way, we will, as long as we know about them and figure out what they're eligible for, we can help get them to the path that's going to lead them to long-term permanent housing. So a lot of veterans, we have to start with verifying what their VA eligibility is so we know what we can offer them. That can look like full VA healthcare benefits, or it can look like just access to homeless programs. And veterans who have full healthcare also have access to homeless programs as well. It's all very complicated and based on the time they served, what era they served in, how long, and what their discharge status was. So a lot of times I tell folks that they can just email me the veteran's name and their full social security number and date of birth if they're willing to provide that. And then I can work with our eligibility specialist and we can find out within a day what that veteran is eligible for. We also use the Homeless Management Information System, or HMIS system, within our community. So a lot of times I can find that information if a veteran has a profile in that system. We can just go in there and find their name and get that information from there. We also use the HMIS system to manage and enter and exit veterans onto our by name list, which is basically a master list of every veteran that we know of by name in the 7 metro county region who are experiencing literal homelessness. And when I say literal homelessness, I'm talking about veterans that are outside on the streets, in emergency shelters, sleeping in their cars, under bridges, staying in motels or hotels paid for by an agency, essentially what HUD's definition of literal homelessness is. So we have several different kinds of programs for housing through the VA. The most basic program is the Supportive Services for Veteran Families, or SSVF programs. There are 2 agencies that actually manage those grants: Rocky Mountain Human Services and Volunteers of America. So those SSVF programs are essentially programs that have homeless prevention funds and rapid rehousing money. They also offer some light case management to help veterans navigate some systems, housing navigation to try to find affordable housing, if there is any left, which seems like there's not these days, and really trying to get them maybe linked to some longer term programs. One of those longer term programs would be the HUD VASH program, which essentially is a partnership between HUD, Housing and Urban Development. HUD provides basically a Section 8 voucher to the veteran, and then the VA provides ongoing intensive case management to that veteran as long as they need and qualify for the program. So it is essentially permanent supportive housing. And then we also have transitional housing through the VA. It's called Grant and Per Diem, or GPD, because the feds love their acronyms. And you'll find many programs have several different names to make things even more confusing. So transitional housing through the VA, we have several different sites. A lot of them are based in the Denver area, the city and county of Denver, I'd say the majority of them. And we have Comitis Crisis Center in Aurora. So there's one in Aurora. And those programs, veterans can stay in for up to 2 years if they need to. Each program is a little different. A lot of them have basic case management, helping veterans to establish income or save money, apply for benefits. The housing navigation, looking for housing that they can afford, maybe applying for like senior subsidized housing, and all those glorious wait lists. Getting them connected to healthcare, either through the VA or through the community, getting them connected to substance abuse or mental health treatment, legal assistance for any kinds of legal issues that they need to clear up or need assistance with. And then we have some like lower demand transitional housing sites for veterans who are struggling with substance abuse or maybe just don't want to quit. We do have one program called Beacon Place, which is in Denver, but veterans can essentially go there, continue to use whatever substances they're using, not on site, but off site, and then come back in and not be, kicked out because they're not, abstinent or sober. And so really focusing on trying to get our veterans housed for the long term, right? Not these Band-Aid programs. We do see a lot, we do a lot of data collection with the help of our community partners. And we do see that Black, Indigenous, and people of color are way overrepresented in our homeless coordinated entry system, which I think is true for probably the rest of the United States as well. We also see that white veterans are housed faster than Black and Indigenous people of color. And so that has been, we've been collecting data on that for the last 4 years, and that's been true for all 4 years. A lot of that related to what Jeannie was saying, right? The systemic racism that is really embedded in all these systems, including housing. We're also seeing a overrepresentation of elderly, aging, and medically vulnerable veterans, more so in the past 2 years than we've ever seen. So veterans that are needing like higher levels of care, like assisted living or skilled nursing facilities. And there are really not a lot of services for those veterans who are homeless, right? Emergency shelters might kick them out if they can't do their ADLs or their activities of daily living. These transitional housing sites won't take them for the same reasons. Even these permanent supportive housing are saying they need higher levels of care. Well, that's great, but where do they stay in the midst of applying for long-term Medicaid, which we can take six months plus just to get approved. Then they go and apply for the assisted living or skilled nursing homes. So that's a major, major gap in our communities, which I'm sure you're all aware of. So there's a lot of work to be done. One of the other tools that we have done in the last 3 years, we have case conference meetings. Aurora specifically has one too, a veteran case conference meeting, where we will meet. For Aurora, I think it's every 2 weeks. Denver has one, Boulder, all the other ones have one. Denver's is weekly because that's where the majority of our homeless veterans are, because that's where the majority of our emergency and day shelters are. But in these case conference meetings, we have VA staff members, different homeless providers, outreach workers, shelter workers, whoever we can get to come to these meetings who can help move that veteran closer to housing. We invite to those meetings, and essentially it's an action-oriented meeting. So we're talking about, John Smith was just identified as a homeless veteran. He's eligible for only homeless programs. We try to get our outreach workers to go to our veterans outside in the community, knowing that they're just not going to walk in our door, right, and ask for services a lot of times for a varied amount of reasons. One probably being transportation, and access to getting bus tickets and things like that. So we want to know about all these veterans. So really asking the question, did you serve in the military? Yes or no? Are you experiencing homelessness? And if they say yes to those things, definitely reach out to me. I'm going to put my contact info in the chat here too. But we want to know about them. We want to see what we can do to help get them connected to resources for housing, resources for healthcare, whatever is going to improve their quality of life, and get them stable, is kind of our mission. Any questions so far? There's a lot of
I'm
information.
just like the speaker's pet today. So the case conferences, is that something that your team is running, or are you attending that, or is the city running it? Who runs those conferences?
Sure. So it's different in each community. For Aurora, Emily Fuller is the facilitator for that, and she works for Aurora City Government Homeless Program. I run the one for Denver County and for Boulder. And then different providers run different county ones. So it's really whoever has the capacity and the facilitation skills to kind of make that a smooth meeting, and making sure that we're not skipping over anyone, and really making it an action-oriented meeting, not just like an update meeting, right? That could have just been an email, because we don't want to be mindful of people's time, knowing that almost every program that I've encountered, we're all short-staffed these days.
Yeah.
And doing double duty. So really trying to give people grace too, and just partner, knowing that the VA is not going to house every veteran. It's going to take a community, right? And one homeless veteran is just too many. And in the last year, I would say, well, in December, we had 391 actively homeless veterans that we know of. There's probably more. Those are just the ones that we know of in our region.
Wow.
But luckily, last year in 2022, we were able to house 410 veterans from literal homelessness to housed permanent housing. And we saw a 16% reduction in the overall actively homeless veterans for the year. So we're hoping in 2024 to see maybe a 30% decrease, because we're pretty ambitious folks. 16% is great, right? It's not an increase, but we would really like to try to double that if we could, for 2024.
Lauren, I have a question. What
Yeah.
is there a threshold or a definition of homelessness for an individual, for a veteran? I mean, you were saying literally someone who has no place to go or is on the street, but are you able to connect with folks who may be, couch surfing or staying somewhere that's not temporary, or that's not permanent?
Yes, we can definitely work with veterans who are unstably housed or at risk of becoming homeless as well. So for the HUD-VASH program, the permanent supportive housing one, veterans do have to be literally homeless to even be eligible for that one, or have a history of chronic homelessness. But for the transitional housing, they don't. SSVF, they don't. So we can definitely hook those folks up and try to prevent them from hitting that literal homeless mark or the streets. And we definitely need to get better at that. I think, homeless prevention, we just been trying to deal with the folks that are out in the streets for the last several years, and COVID really ramped things up. That like prevention became on the back burner, and we really do need to focus more of our attention and resources to prevention, so that people don't have to experience that traumatic event. It's extremely traumatic, and a lot of these folks, it's not their first time experiencing it. And so we really just want to send our outreach workers to them, and not just give them a phone number or say, show up at this office. We have those too, but it doesn't seem as effective as, that person to person warm handoff, seeing that person genuinely wants to help them towards housing, and not just giving them a load of BS, right? Which they've had and experienced far too well.
Thank you. Jeannie, I see your hand up.
I do have my hand up. I am just curious, this drastic increase in the older adult population of veterans being homeless, has that just occurred since the pandemic time, or has it been a long time coming?
I think it's been a long time coming. I mean, right, our veterans are going to continue to age. I do think COVID did ramp things up in terms of like just just the time of people losing benefits, losing jobs, new health issues arising, right? So they can't work anymore. The cost of rents and everything that has gone up. And then now that all the COVID money is gone, we're seeing it even more, right? All those supports that people had to kind of keep them in their homes are gone. Food stamps are cut. All these programs are being cut. And so a lot of those programs were supporting our elderly veterans who, at, some of our 70, 80 plus years old veterans aren't really going to be able to make any more money, and 900 to 1,200 bucks a month from Social Security is just not going to cut it. Just to pay, for a 1 bedroom, which is far over that anyways. So it's just so many things. It's just the perfect storm.
Thank you.
And there is a question in the chat, Lauren. So we'll take this one last question. If a veteran moves into Denver, for instance, from Aurora, drops off Aurora's by name list, are they automatically picked up on the Denver list, or how does that work?
Sure. So we can switch them over. We put people in the subregion where they're experiencing homelessness the most, or where they have ties to the community. Maybe that's where they're going for their providers. If a veteran drops over to the Denver shelter for a night or two, we'll probably still keep them in Aurora because that's where all their main providers are. And that's where we know they're going to go back. But then there are times when folks will come from Aurora and go to Denver because they want to stay at, 48th Street shelter and they know they'll have a bed there consistently. Then we would move them to the Denver by name list, and then they would start being discussed in the Denver case conference meeting. So we're trying to track where they are, and see also like where do they want to live? Where are we going to be able to access resources for housing for them? So they also feel like they have somewhat of a choice in this predicament, which I think a lot of times they don't feel that way, or there really is no choice, right? Because it's like, I just need to get inside, especially with this sub-degree weather we just had over the weekend. I mean, it's life or death in the realm of homelessness for sure.
Thanks, Lauren. We appreciate it. And if you have any links or resources or information, feel free to send them along and we'll include them in our post-quarterly meeting.
Yes, I
Round
definitely will.
table.
I'll send a PowerPoint that was more than 4 slides, but I'll send that to you guys so you know where our homeless clinics are, contact information, more overviews about those programs I talked about. I don't expect everybody to remember all that, but I'll definitely send that over to you.
And then what are you looking forward to in your work in 2024?
Oh
Keeping it
man, so many
consistent.
things. Just to do better overall. Continuous process improvement, especially in a federal system, housing more veterans than we housed in 2023, reaching out to more community members so they know how to refer their veterans to us, just advertising ourselves more. Because I think in the federal world, they're not very good at that. And we can't expect veterans to just know what they're eligible for. We need to go and let them know, hey, did you know that you're eligible for this? And a lot of times they don't know. So really just doing better overall.
I'm thrilled for 2024 to be able to have a more solid connection within the VA, to build our partnership, continue doing that. So thank you so much for being here.
Yeah, thanks for having me.
Thanks, Lauren. And thank you to all of our presenters today, Michele, Jeannie, and Lauren. Thank you all so much for the great work you do and for sharing your work with us. We are happy to send out your information and hopefully some more connections will be made. So thank you so much.
I'm off mute, no problem. So I'm Shay Jacobs, and I'm the Community Development Outreach Manager at Family Support Resource Center and the Executive Director at Adams Purpose. We have a couple of things going on. On the first Wednesday of the month, we hold a community and a participant meeting to bridge the gap between what our participants are experiencing and what our community members, how they want to contribute. But specifically, we're going to be celebrating all the moms that have walked through our program and their babies, and just basically having a celebration for moms and babies the first Wednesday of February. So we open those up to the community to come in and share with the work that we're doing. And also with our organization, Adam's Purpose, we provide bereavement support for Black moms and moms of color who have experienced pregnancy loss. And those are 7-week cohorts. Then I can put the information to all of those things in the chat.
Yeah, thank you so much for the presentations. Two of the people I do know that were speaking, so it was good hearing their voices, seeing them, and Shay too with her amazing organization. My name is Eva Plummer. I'm the executive director of Show and Tell. We help families who have children with disabilities navigate special education, and we always have things going on. And I still do not know how to click a flyer on the chat, but I can send a link to our organization, and then you could see all the things that we're doing. We do parent advising year round. So a parent who's having trouble with their child making progress, or their child not getting the supports they need, they can call us and we'll do one-on-one advising. Telling them, yes, the school can do that, but they can't do that. And yeah, you have a right to have this, and no, you're not imagining things, your gut saying this, honor that gut feeling. And we also do trainings, and all our services are no cost to families. So we have training, so we train families how to support their kids in special education. Because a lot of times these kids are not getting the supports they need. And 2 years ago, it made in the news with Denver Public Schools sending 99 Black boys to effective needs centers, which is for children who have emotional disturbance diagnosis, and they can't be dealt with in the classroom. So they put them in these centers. But they sent these 99 boys without even evaluating them. So we do suspect that many of them didn't even belong there in the first place. And so we're still trying to rectify that. And so that's where we come in. We want to train parents, because would that have happened to a parent who was very knowledgeable? Nope. I'm a knowledgeable parent. That would have never happened to my kid. So we want families to be knowledgeable and know what their rights are, how to support their kids. And that's what we're here for. So I'll put our website in the chat.
Again, thank you to our Did You Know presenters. Thank you so much for sharing the great work you do. And thank you all for being with us today. We look forward to seeing you in April and at any of our other AHA meetings. So thank you all so much for being here.
Thanks, everyone.